Okay, so it looks like this tooth is going to need a root canal, so I'm going to refer you to a specialist. I have to go somewhere else? I can't just get it done here? Unfortunately, no, this tooth is going to require you to see a specialist. But I thought you do root canals. Well, I do some root canals, but this one's going to be a little complicated, so I think you should see a specialist. Huh, okay, that's confusing. Dentistry can be confusing. You may think that one dentist is the place to go for everything mouth related, but usually that's not the case. When I was a kid, I used to think my orthodontist and my general dentist were the same person. Turns out they weren't. Hey guys, my name is Amanpreet Singh and I'm the founder of Dental Secrets. If you haven't already, make sure you hit the thumbs up button and subscribe to the channel below. Let's get into it. So it sounds like your general family dentist is not the place to go for everything dental related. So what are the different dental specialties? I'll start with your hygienist. Hygienists are not dentists, but they are board certified and they have received extra training to work on your teeth. A hygienist tends to be more on the preventative side of things. So this will be the person you see every 6 months for your cleaning or more frequently depending on the health of your gums. Your hygienist will typically check the health of your gums, clean off any tartar or plaque that's built up on your teeth, and they'll also go over your oral hygiene and your diet and ways to improve that to improve the health of your mouth. They'll also point out any findings or anything suspicious that they found to the general dentist who will come in for an exam. Now comes the general dentist. That's where you'll see me. A general dentist is probably the most confusing specialty in the dental field. The reason is a general dentist can do anything. They can do anything that they feel comfortable with, aside from a few major surgeries which we'll get into later in this video. But if we're just talking about the basics, your general dentist will typically do any restorative work and work to get you out of pain. So that'll include doing your exams, your fillings, your crowns, and sometimes bridges, and sometimes even some extractions. But that doesn't mean that your dentist is limited there. Your dentist can actually choose to do more or even less procedures depending on what they feel comfortable with. For example, a lot of dentists do Invisalign, which typically would go to an orthodontist, and some dentists even do full braces, even though they're not an orthodontist. Some dentists see a lot of kids, they do a lot of dentures, they can do a lot of root canals, and some of them even do implants. The list just goes on, and it really depends on how comfortable the dentist is. Actually, I know some dentists that don't even do any restorative work anymore, they just do some stuff more on the surgery side. Wait, are you saying a dentist can do anything they want just because they feel like it? So you can take out this tooth for me, right? Well, I'm not super comfortable with it, but I can give it a shot. I mean, I am technically allowed to do it. Okay, that sounds terrifying, but general dentists that do these more complex procedures typically take more extensive training, so that's why they feel more comfortable doing it. And general dentists that do these more complex procedures are held to the same standard as a specialist. Next, we have your orthodontist. If you ever had braces as a kid or had an expander or something like that, this is where you got it from. The role of an orthodontist is to straighten your teeth. This is typically done on younger patients because that's when their teeth are crooked and they want to get it done right away, and it's usually for aesthetic reasons. But that's not always the case. Sometimes an orthodontist will work with a surgeon as well, because sometimes people's jaws did not grow properly, and that's what's causing their teeth to be misaligned, so sometimes they'll require a jaw surgery before getting braces. And sometimes they'll work together with someone placing an implant, because sometimes you have very little space in between two teeth, and if you're trying to place an implant in there, you need as much room as possible. So an orthodontist can actually straighten those teeth and create more room for the person placing an implant. But generally, orthodontists work a lot with kids, which means they also work alongside a pediodontist as well. Which brings us to our next specialty, which is a pediodontist or a pediatric dentist. Just like your pediatrician, a pediodontist or a pediatric dentist will see your kids. Again, a lot of general dentists can see kids as well, but your pediatric dentist will see all the difficult kids, and also kids that have special needs. Pediatric dentists are experts at making kids feel comfortable in the dental office. Typically, they'll keep everything kid-friendly, and they'll use a lot of friendly words, like instead of calling it a cavity, they'll call them sugar bugs. And they'll usually give the kids a toy or something like that after their appointment. Next, we have your oral surgeon. Your oral surgeon is known to be the one that takes out your wisdom teeth. Fun times. Along with taking out your wisdom teeth, an oral surgeon can do all sorts of surgeries, including things like full jaw reconstruction. I actually watched an oral surgeon do surgery on someone's leg before. Wait, an oral surgeon did surgery on someone's leg? Dude, that doesn't make any sense. Most oral surgeons go through general surgery residency before specializing in surgery involving the mouth. But just like general dentists, not every oral surgeon does these extensive surgeries. It all comes down to what they feel like doing and what they're comfortable doing. Next, we have your endodontist. Root canals, root canals, root canals. Endodontists live, eat, and breathe root canals. Okay, maybe that's not all they do, but that's mostly what they do, like 90% of the time. They can also help diagnose cracked teeth or teeth that have an abscess, which usually means that they need a root canal. But most general dentists who do their own root canals will still refer to an endodontist when it's a really difficult case. So an endodontist is specialized to do a root canal on any type of tooth, including difficult cases where your canals are calcified, which basically means that it's almost impossible to see where the canals are, or even cases where the roots of your teeth are curved and it just looks like a ballerina is dancing in your bone. A lot of endodontists will have fancy tools like a microscope to help them see inside these smaller spaces. Up next we have a periodontist, and they do a lot of specialized procedures involving your gum health and gum disease. So a periodontist will typically do things like tissue grafting involving your gums, they'll place dental implants, and they can also do extractions with socket preservation, which is basically after you get an extraction and putting bone graft in that socket so that that bone heals well and it's ready for a future implant. Lastly, we have a prosthodontist. A prosthodontist is basically a general dentist but on steroids. They'll do things like full mouth reconstruction, cases where patients have lost their bite and they have to reestablish it, and they can do cases where placing a denture is going to be really difficult because the patient barely has any bone left and there's not much for that denture to hold on to. And again, some general dentists will do this stuff on their own, but most people will end up referring to a prosthodontist because it's just a little beyond their comfort level. And there's also a couple low-key specialties like an oral pathologist and an oral radiologist, which not many people know about and there's not as many around. But an oral pathologist will basically detect early signs of oral cancer, and an oral radiologist has more extensive training on reading x-rays, and they can help diagnose diseases and conditions in the mouth and face. So that's pretty much an overview of all the major dental specialties. If you had any other questions about that or wanted me to go over anything in more detail, please let me know in the comment section below. And as always, thank you guys for watching. I hope you liked that video. If you haven't already, please hit the thumbs up button and subscribe to my channel below. We'll see you in the next video.